So hi everyone, my name is Molly McCormick. I'm happy that you are joining us today for this topic. I am one of the Lori Pediatric Dental residents, and today we'll be discussing the importance of dental care for children who have undergone transplants. So we understand that managing your child's health after a transplant involves many considerations, and we know that dental care might feel like one more thing already on a full plate, but we are here to assure you that we're here to help and make this aspect of your child's care manageable and effective. So just to get started with some basics of oral care routine, the most important thing is we want to make it as kid-friendly and fun as possible. So just remember, the more fun and engaging the dental care is, the more likely your child will be willing to participate. So some strategies we may recommend would be making oral hygiene an interactive activity, whether that's by using like reward systems, creating visual charts to track brushing and flossing, or playing your child's favorite music at brushing time. Those are some things that we have found to be helpful. And then as far as instructions for brushing, we recommend using a soft bristled toothbrush, ideally an electric toothbrush in gentle circular motions. Ensure that your child is brushing for a minimum of 2 minutes twice daily. The nice thing with electric toothbrushes is a lot of them will time this for you, so you don't have to worry about the timing. And then we ask that you replace the toothbrush or toothbrush head every 3 to 4 months or anytime your child undergoes some sort of illness. And then regarding toothpaste amount, over here you can see the recommendations based on their age. And then most importantly, we recommend no food or drinks being consumed after brushing at nighttime other than plain water. And then continuing on talking about flossing, we believe this is just as important as brushing, and we recommend using gentle wax floss once daily just at nighttime, especially when the kids' teeth are touching. If those spaces are open, not as important to be flossing in between there because the toothbrush can more than likely clean that area. But when the teeth are closed, the floss will help remove any plaque or food from between the teeth. If your child has sensitive gums, which can be pretty common after transplant due to certain medications, you can consider something like a water flosser or something that's a little bit more gentler as an alternative. And then as you can see here on the slide, there's several options. So there's that water flosser. Floss picks are easy with young kids who have minimal like manual dexterity and hand skills. That's a little bit easier for them. There's the traditional string floss, and then something else as well as an electric floss moves that floss back and forth between that space for you. And then here's just some additional care tools that I wanted to mention beyond just brushing and flossing. So if your child wants to use a mouthwash, we recommend something that's alcohol-free and antimicrobial. We also recommend xylitol products. With these, we recommend at least 5 to 6 exposures per day with at least 1 gram of xylitol per exposure. This is super helpful in preventing cavities in addition to something like a fluoride toothpaste. And then if your child experiences dry mouth, which can be pretty common, there are some specialized gels that can be used or mouthwashes. These would be something to ask your dentist about regarding specific brands. And then some other tools that I wanted to mention were interdental brushes. These become nice when kids have like braces and brackets and wires in their mouth, or it might be a little bit easier to clean between the teeth than floss. And then let's see. So then diet for us plays a crucial role in oral health, especially for our transplant recipients. Some recommendations is avoiding any sticky candies, sugary drinks like juice, soda, sport drinks like Gatorade, acidic foods, and then also something that a lot of people don't think about are fermentable carbs. So these would be like pretzels, crackers, goldfish, cookies, chips. And then with these foods also, we recommend limiting snacking. If your child is snacking frequently throughout the day, this actually increases cavity risk because we're providing a constant food source for the bacteria that live in the mouth. So instead, we recommend opting for a soft, nutrient-dense diet with foods like cheese, yogurt, proteins, crunchy fruits, and vegetables. These all will help naturally clean the teeth. And then, if your child is having any sugary beverages or sugary foods, we encourage them to be drinking water after and also often throughout the day. This just helps to wash away any bacteria on the teeth, also keep up our saliva production, and then prevent dry mouth, which is all particularly important after undergoing a transplant. And then also, I wanted to mention that we recommend regular dental checkups at least every 6 months. If your dentist or transplant team recommends more, that is an option as well, but I would consult with your dentist to decide. So, why is dental care important after transplant? You might be wondering why we're emphasizing it so much. So, the reason is that because your child's immune system is weaker due to the medications that they're taking to prevent organ rejection after the transplant. This makes them more susceptible to other infections, including those that may present in the mouth. So, even small injuries to the gums can introduce bacteria into the bloodstream, which can be particularly dangerous when the immune system is suppressed. So, this is why it's vital to establish good oral health habits and address any dental issues before the transplant to minimize potential problems after. And then just continuing on, I wanted to mention that patients with a history of transplant face unique oral health risks due to these medications, which makes it harder to fight infections. Some of these risks would be gum disease, cavities, oral infections, and these can be more severe and harder to treat in patients who have had a transplant. Okay, so now we're going to dive a little bit deeper into specific oral health risks post-transplant. First is the impact of immunosuppression. So as we know, you have reduced immune response, which makes the oral tissues more vulnerable to certain infections. This is because there's a decreased ability to fight bacterial and fungal infections. And then there's also a slower healing process for mouth wounds or irritations as well. Secondly, some medications can lead to oral health complications, being dry mouth, increased risk of gum inflammation. So you might see bleeding and swelling in the gums, and then also plaque buildup. And then there are also options of changes in saliva composition, which may make it harder to fight off these cavities, which would cause higher susceptibility of tooth decay. So, some ways to prevent these issues would be to develop an oral health plan with both your transplant and dental teams, have them working together to make a specialized plan for your child. And then we recommend scheduling frequent checkups, like I said, at least every 6 months. Sometimes we may recommend 3 to 4 months if we see that fit. And then maintaining a good oral hygiene routine. Continuing on, some specific risks include gum disease, which is more likely due to the immune suppression. As you can see in this picture on the right, there's a little bit of redness near that word, like cavity, and then also on the bottom where it says gingival inflammation. And then also, like I mentioned, tooth decay is seen at higher rates in transplant recipients, and studies have shown that these kids actually have 2 to 3 times of higher rates compared to their healthy peers. And we see this more than likely due to either steroids or immunosuppressants that can weaken that outer layer of the tooth, which we call enamel. Some oral infections, particularly fungal infections like thrush, are more common due to reduced immune defenses as well. And then any medication side effects, such as dry mouth, can create this environment where bacteria are able to thrive more easily. And then going back to this picture, just some things to be on the lookout for. So for children that do have braces, something we commonly see are these white spot lesions, which is like a chalky white appearance. It typically surrounds those brackets on the teeth. When this sits there and is not remineralized by something like fluoride, it can lead to something like a cavity, which you can see on that other side, which is more so like a hole in that tooth. So these are just some things to be on the lookout for. Typically, when we see those white spot lesions, we may recommend like a higher prescription toothpaste. So that could be something to ask your dentist about. So, how might this information relate to my child? Immunosuppressants like tacrolimus or cyclosporin may cause some gum overgrowth. This is known as gingival hyperplasia. Um, Cyclosporin, which we know is a common anti-rejection drug, we actually see that it causes this condition in about 30 to 50% of pediatric patients, meaning that they have increased plaque retention and then also gum inflammation. So, to manage this, to help prevent it from getting any worse, we would recommend either electric toothbrushes that have like pressure sensors on them that kind of vibrate if you're pushing too hard or not hard enough. And then also flossing will actually be super helpful with keeping the area in between the teeth really clean and preventing these swollen gums. And then, like I had mentioned before, these medications can cause dry mouth, which we as dentists calls something called xerostomia. And then this dry mouth can increase risk for cavities. So your dentist, like I said, may recommend a prescription strength fluoride toothpaste to reduce chance of breakdown of that outer layer of the teeth. Or we could do something that increases saliva production and stimulation. Those could either be sugar-free gum that has xylitol. So one example that we may recommend is this pure gum that has xylitol in it, or we could do saliva substitutes like rinses, such as the brand Biotene, which can help alleviate some of these dry mouth symptoms. And then also something to keep in mind if your child is taking sirolimus, there are specific oral care considerations to be aware of. So common oral side effects associated with this medication are at-fist ulcers, also known as like mouth sores or canker sores. These can affect 10 to 25% of patients and often appear within the first few months of therapy. And we often see them either on the lips, the tongue, the inner parts of the cheek, or also the roof of the mouth. And they can cause pain, difficulty eating, or even challenges with speaking. So, some ways for prevention are, like I said, regular dental checkups, soft bristled toothbrushes, nothing that could aggravate these tissues, mouthwash that's alcohol free, and then also adequate hydration. Additionally, here are some other recommendations for management. So one is something called Magic Mouthwash. This contains some active ingredients that provide a numbing relief to help with any associated pain. It can also reduce inflammation. It has a medication that coats those sores as well to help with eating, and then can also prevent fungal infections. And then typical instructions for this is to rinse with 1 to 2 teaspoons for about 1 to 2 minutes and then spit. And then we typically say to use it 15 minutes before mealtime and then also at bedtime. This is something that would require a prescription either from your transplant team or from your dental home. And then some other oral hygiene modifications would be something called SLS free toothpaste. Some common brands are Hello, Sensodyne, Biotene, or Closis. And these help to reduce any irritation to sensitive oral tissues. Reason being we say SLS free is because the ingredient SLS in toothpaste can increase risk and severity of ulceration in some patients. And then I just wanted to point out some common warning signs if you're concerned about like cavities developing or what these gums would look like that I have been mentioning. So red, swollen, or bleeding gums can be a sign of gum disease or potential infection. So if you ever were to see like a pimple on the gums, as you see in the second and third photo here, that's what we call a dental abscess. That is a sign that that tooth is infected. So this is something we would want you to let the dentist know about. Sometimes we may recommend prescribing antibiotics. And then another sign as well of either decay, gum disease, or infection could be persistent bad breath. Some more warning signs to include would be tooth pain or sensitivity, which may be a signal that there's cavities or erosion of the teeth. Um, so that would be when your child is drinking cold water or eating hot food items. If your child's waking up in pain at night, those are kind of the symptoms of pain that we'd be looking for. And then something else to consider are these white patches, sores, or ulcers that may be signs of like a fungal infection, such as thrush or viral sores. And if you were to ever notice any of these, we would recommend calling your dentist as soon as it's noted. So now we're going to discuss some other considerations post-transplant. So it's recommended to consult with your child's transplant specialist regarding when they should return to the dentist for their routine cleanings, exams, and any sort of treatment. Typically, when patients have undergone organ transplant, they best tolerate dental care starting about 3 months after the transplant when their overall health has improved. But this is something that we would want to check in with your transplant team about first. And then something else to keep in mind is sometimes transplant recipients may need antibiotics before dental work to prevent bacterial infections. Some high risk patients, just to keep in mind, would be children with heart conditions who have had recent transplants or any sort of implants. And then some procedures where this would be required, that they would take antibiotics, would be deeper cleanings that may induce bleeding, extractions, which is the removal of teeth, or undergoing a surgery. But like I mentioned before, this is something parents should consult the transplant team about to determine if antibiotics are necessary prior to dental treatment. And then getting into pain management. So when it comes to pain management, parents should consult with their transplant team before using any pain medication. Some examples would be pre-transplant restrictions, including NSAIDs like ibuprofen or naproxen if a patient's awaiting a kidney transplant, or avoiding Tylenol for patients with compromised liver function. And then post-transplant, most patients are able to return to their standard pain medications as the organ function normalizes, but every case is unique and medication plans should be personalized. So I don't want to give you those recommendations today, something to ask your transplant team about. Okay, and then as I mentioned before, for children with braces, extra cleaning care is recommended to prevent any plaque buildup or gum inflammation. Even if your child is undergoing Invisalign treatment, it's still more common to get this inflammation. Reason being is the teeth are moving and causing that aggravation to the gums. So we just have to take extra precautions to be keeping everything clean. And then with those retainers or trays, also cleaning them daily with either like a toothbrush or a dissolving tablet that you can soak it in. And then I know one thing that a lot of families mention is wisdom teeth removal. So sometimes we may recommend that this procedure is done in a hospital setting due to possible infection risks or medication interactions. So if your child ever does see an oral surgeon for consultation regarding wisdom teeth removal, just keep this in mind as something to mention to them, and also mention it to your transplant team as well. And then another slide we wanted to mention is something called pre-transplant hyperbilirubinemia that may be seen. So this can deposit bilirubin pigments into the developing tooth structures, either in baby teeth or adult teeth, and you may see an intrinsic yellow-green discoloration in these teeth. So unlike staining you may see from coffee or soda or other foods, this discoloration actually is not able to be removed by like whitening or brushing of the teeth. So some cosmetic and preventative solutions that we have found, for mild staining, dentists can use a process called microabrasion, where they can remove some superficial discoloration without affecting that outer layer of the teeth. Something else that we may consider in adult teeth is something like composite veneers that can be placed over the natural tooth structure. And then also preventative monitoring, so following up with your dentist regularly, so that we could detect early signs of this, and give our feedback as well. And then also, something to keep in mind for any children that are fed through G-tube, there are specific dental considerations. So these children may be at an increased risk for certain oral health problems, such as calculus buildup. So calculus is a hardened plaque. It's typically yellow in color, and when it is sitting along the gum lines, it can irritate that area. Something else we may see is tooth erosion, which is the wearing away of that outer layer of teeth, which could be caused by acid in the stomach. And then also, like I mentioned before, dry mouth, which can increase cavities and gum disease. So even though your child isn't eating by mouth, it's still crucial to take care of their teeth and gums. While they may be at a lower risk for developing cavities, we still want to make sure we're brushing twice a day with a soft toothbrush and fluoride toothpaste. And then keeping the mouth moist with either something like a humidifier or like wet washcloth, something like that. And then lastly, just wanted to mention some of the important key takeaways. Remembering to brush and floss daily. Consistency is key for maintaining this healthy smile. And a lot of times, if kids have irritated gums or their teeth are bothering them, they're not really motivated to keep up with this routine. But the consistency helps make it a little bit more comfortable and easier for them to keep up with it. Also, mentioning working with both your medical and dental team to address any transplant related oral health needs, making sure we understand the side effects of some medications and how to prevent dry mouth and gum issues, and then recognizing those warning signs that I mentioned, like swelling, pain, persistent sores, and seeking care as soon as they're noted. And then lastly, making those good dietary choices to support strong and healthy teeth. And then I just wanted to thank everyone for your attention today. If you have any questions, please don't hesitate to reach out to our department. Our phone number is at the bottom of the screen here. And just so you know, we're always here to support you and your child on this journey. And just remember that maintaining good oral health is an important part of your child's overall well-being after the transplant, and we're happy to help in any way we can. Thank you.